Might as well.
Thank you, Patty. All right, I'm going to share my screen. I got it all organized. All right. Jamie, can everyone see my screen okay?
Hmm.
Great. All right, welcome everyone. We're going to get started very shortly. I'm seeing a lot of folks. I'm seeing the peer support centers. Hello. We're going to start very soon, but while we're waiting, my colleague Jamie just dropped into the chat the demographic form link. If you are attending via Zoom, click on that link. Please just take a couple moments to fill out the demographic form. If you're at a peer support center, you can fill it out on paper. A coordinator on site should have the papers printed out. If not, you can scan the QR code that's on the screen and take it via phone, iPad, whatever device is available.
The rate depends on a variety of factors, whether there are funds for a raise and
Great. All right, for those that just joined us, I'm going to just announce if you can take a few moments to fill out our demographic form. There is a link in the chat, and the link and QR code is also on the screen. We're going to get started in just a moment. Feel free to fill out the demographic form, grab a water, grab a coffee. If you're at the Peer Support Center, feel free to fill out the demographic form on paper if that's available, or scan the QR code. Right. Okay, it's 10:05. I think we will get started. All right. Okay. Hello, everyone. We're so excited that everyone can join us this morning. Thank you for making time to join us for Lake County's MHSA Community Planning Meeting for the fiscal year 25-26 annual update. Really excited to kick off this meeting, and to start us off, I'm going to pass it over to Scott Abbott for a brief welcome and opening remarks. So over to you, Scott.
Thank you. My name is Scott Abbott. I'm the MHSA Program Manager for Lake County Behavioral Health. And as Paulina said, I would like to welcome you out to our meeting. Appreciate very profusely your time in being here, recognizing you have a lot of other things you could do. But this is a really significant process that we're going through. Um, We're going through our last update of our current 3-year plan in MHSA world. Next year, we'll be embarking on a much different journey with BHSA, the Behavioral Health Services Act, which will encompass the entire department. Right now, we're still focusing on MHSA plans and programs. And so our first meeting and what we've been doing up to this point has been gathering information. This meeting will be really great because you'll be able to see the results of that information and that data that was collected, and hopefully that will guide us to make some suggestions for some plans. But also, as I mentioned, because BHSA is coming up, we'll talk a little bit about that too, because even though that's a year away, um, because it's going to be some significant changes, we'll want to start even talking about that earlier than we normally do to make some of those adjustments, and so we'll bring up that a little bit as well. Let me turn it back over to the fine folks at RDA who are consultants for this project, as they always are. Some really outstanding folks that we appreciate greatly, both Pauline and Jamie. And so, Pauline, back to you.
Oh, thank you, Scott. And likewise, we're really honored to be here and to be a part of this meeting and get to meet all of you. And speaking of that, we would love for everyone, if you're able to, we would love to know your name, pronouns, and what program you're calling from, if you are able. We would just love to know who's in the room today. So if you're able to online, feel free to write in the chat your name, pronouns, and your program. If you're not affiliated with a program, feel free to put your role or maybe where you're calling from. We have so many folks joining, so it's a little bit difficult to do individual introductions, which we would love to. But feel free to populate the chat so all of the other folks can also know who's in the room. I do want to acknowledge, as you can see, that this is a hybrid meeting, and the peer support centers have graciously agreed to host the meeting in person, which is incredible. If the peer support centers are able, feel free to come off mute. We would love to know what peer support centers we have in attendance and how many people you have in the room. So if we can, does anyone want to start? Do we want to start with the harbor? Feel free to come off mute.
Did you see my beautiful face come into frame?
I did.
Yes. So, Harbor Youth Resource Center. I'm Raven Wilczewski, the peer support specialist, and right now we're joined by Stacy Johnson, our YDS, Kayla Cavillo, our peer support counselor, and Justin Perez, our supervisor.
Awesome. Thank you so much.
No problem.
All right. Next, Peer Support Center, I see Lavos. I know Big Oak is in attendance. Feel free to come off mute and say hello.
Hi, this is Amy over at the Circle of Native Minds. We have 2 guests here this morning and look forward to all the good information.
Awesome. Thank you. All right, over to Lavos.
Good morning, everyone. There's 12 people here at the meeting, and we're more than happy to be part of this meeting. Thank you.
Thank you. Thank you all for being here. All right. Big Oak, are you able to come off mute and say hello? Or feel free to put it in the chat as well, how many folks are with you. All right. Okay, I don't know if I'm missing any other peer support centers.
That would be it.
All right, awesome. And I'm seeing people in the chat. Thank you. I'm seeing Amanda Hicks, Tina, Karen, Rachel, Raven, Alvin. Hello, hello. Jermaine, Gerardo, welcome. So happy that you're all here today. Lastly, before we move on from introductions, I do want to introduce ourselves very briefly. So my name is Paulina Hatfield, and I'm a consultant with RDA Consulting. My colleague Jamie Dorsey is also in attendance. And we've been working with Lake County Behavioral Health for a couple years. And right now we are working with them on their fiscal year 25-26 annual update, which is why we're all here today. But we have worked with them in years past, so the last year's annual update as well as the 3-year plan. So we're always so honored and greatly enjoy being a part of this MHSA planning process. So thank you for having us. All right, going into our agenda. So everything kind of goes at one time. So we're going to kick it off with an MHSA training and education portion where we're going to give an overview of the MHSA, so the Mental Health Services Act, the background, the history, as well as what the annual update is and what the community planning process is, which is what we're all here doing today. And then we're going to move into a Behavioral Health Services Act, or a BHSA overview and Q&A session. Then, as Scott was alluding to, we are going to be sharing community needs assessment findings. So if you all remember, we had a community survey go out, and at our last meeting in January, we also hosted breakout small group discussions. So we gathered all that data, and we're going to present to you our findings. Then we're going to have a 5-minute break, come back and have another set of breakout discussions where we're going to talk about the needs assessment findings and also hear from you what ideas you have in response to the needs in your community, how, what strategies can be put in place, opportunities, etc. And then we'll end with next steps. So our objectives are to provide an opportunity for community members and partners to review and discuss those findings and identify potential opportunities and program changes to better address community needs. All right, before getting into the meeting, I am going to go over some quick tips on how to fully engage in today's meeting, with this being hybrid. So for those in person, there will be a coordinator on site to manage the Zoom room, or to manage the meeting. Well, the Zoom meeting, kind of do both. For those joining virtually, if possible, it's always best to find a quiet, distraction-free location with a strong internet connection. However, I know you're all very, very busy. You're all at different places right now. And so it's okay if that's not possible. If you come into any issues with technology, feel free to put that in the chat and let us know. Either Jamie or I will be able to assist with any technology needs that come up. We also ask that folks save any substantial comments or questions or feedback until the breakout discussions that we have at the end of this meeting. But of course, if you have any clarifying questions, please raise your hand on Zoom, or if you're in person, you can raise it physically or enter your questions into the chat and we will definitely answer those. And yeah, if you're in person, if you do raise your hand, your coordinator will let us know. Also, I do want to say that we do have Spanish versions of our slides. So if anyone online would like those, we can try and get those to you as well. All right, so how to contribute to today's discussion. So not just in the breakout rooms, but if you have any questions, we wanted to run through how you can come off mute, how you can contribute. So for those that are online, you can raise your hand by clicking the participants icon at the very bottom of your screen. And when you're ready to speak, you'll need to unmute yourself, which is in the left-hand corner. It's like a little microphone, and you can unmute that way. If you're calling in, I'm unsure if we have folks that are calling in via phone, you can raise your hand by pressing star or the asterisk symbol and then the number 9. So if you'd like to and you're calling in, feel free to test that out right now, and we can assist if you run into any issues. For those online as well, you can also use the chat feature, which is below, and the icon looks like a comment bubble. And of course, if you don't have, or if you have comments that you don't want to share in the meeting in real time, You can send them via email to Scott Abbott, and his email is on the screen. All right, before I go into the next section, does anyone have any questions or any technology needs that we can troubleshoot in real time? All right. Well, if anything comes up, please let us know. All right, so we're going to go into our first portion of today, which is the Mental Health Services Act training and education. This is a requirement of the MHSA. We want to make sure that everyone is informed on what we'll be talking about today, because that will, I think, enhance community participation. So what is MHSA? MHSA is the Mental Health Services Act and was originally Proposition 63, which was passed on November 2nd, 2004. It's a 1% tax on income over $1 million to expand and transform mental health services. MHSA is a very predominant funding source for many counties, and it's based on 5 core values or guiding principles. So you'll see those in the 5 squares to the right side of your screen. Firstly, there is a focus on wellness, recovery, and resiliency. Next, cultural competence. So that is being aware of and respecting the cultural needs of clients and their families. Next, in the square right in the middle, is consumer and family-driven services. So MHSA prioritizes the needs of consumers and their families. Next, we have integrated services. MHSA is committed to providing integrative services for their clients and family members. And lastly, community collaboration. That's all about working together with the community to share information and resources in order to fulfill a shared vision and goals. And that is what Lake County Behavioral Health is committed to and why we're all here today. All right, so here is an overview of the 5 funding buckets of the Mental Health Services Act. These are also called components. And most programs are funded under one of these funding components. So we're going to start at the top. We have community services and supports, also called CSS. And those include outreach and direct services for serious mental illness for folks of all ages. And half of that CSS funding goes towards full service partnerships. Next, we have prevention and early intervention, PEI. We have a lot of acronyms. And prevention and early intervention is to prevent the development of mental health problems and screen for and intervene when there are early signs of mental health issues or challenges. And half of PEI funding goes towards children and youth services. Next, we have innovation, or INN for short. And innovation funding goes towards programs and services that test new approaches that may improve mental health outcomes. So these are innovative new projects and programs. Now we're going into the gray rectangles, and we have workforce education and training, which is also called WET, and that is funding earmarked for building, retaining, and training the public health, mental health workforce. And lastly, we have capital facilities and technology needs, or CFTN, and that is funding for infrastructure needs. So things like an electronic health record or the physical mental health facilities. So here's a look at all of Lake County's MHSA funded programs under each of those 5 categories. So I'm not going to go through every single one, but this is just to give you an idea of where programs are being funded, what funding sources they fall under within MHSA. So for community services and supports, you'll see we have crisis, access continuum, we have full service partnerships. Like I said earlier, half of that CSS funding goes towards FSPs. We have the peer support centers, Native American peer counseling, parent partner support, and outreach and engagement. For prevention, early intervention within Lake County, that includes early intervention services, older adult outreach and prevention, and then you'll also see duplicates. So peer support centers, outreach and engagement, those two are funded by both CSS and PEI funding. And continuing on with PEI, we have mental health first aid, prevention mini grants, etc. Moving into innovation, for this past period, there are currently no innovation projects. But for capital facilities and technology needs, there's the electronic health record project. And then there's also workforce education and training initiatives that Lake County Behavioral Health is currently providing and administering. All right, so that is the end of the MHSA overview. And so I think my colleague is going to throw into the chat a link to Lake County's website where you can learn more about MHSA whenever you would like after this meeting. All right, so we have the annual update and community program or community planning process. So what is the annual update? So the annual update provides updates to the 3-year plan that was developed for fiscal year 23 to 26. So as Scott mentioned, we had worked together to develop that 3-year plan. And now each year we are writing updates to that plan. So that includes program statuses and service accomplishments that happened in the prior year, but then also looking forward, what changes are about to happen in the next year? So based on that community input, how can programs change or improve to better meet community needs? And the community planning process, that's what we are all here doing today. So the MHSA, or the Mental Health Services Act, intends that there be meaningful community engagement in this planning process, specifically so that you all can provide that subject matter expertise. So I can just see right now, there are providers on this call, there's clients on this call, we have family members on this call and that are joining us today. And you are all subject matter experts. No one knows services better than the ones providing services and the ones that are receiving services. So that's why we're so honored that you all would join us today and be a part of this conversation. So PEI, or Prevention Early Intervention Evaluation Reporting, this is an added piece. So in fiscal year 2018 to 19, the Mental Health Services Oversight and Accountability Commission, which is the overseeing body of the Mental Health Services Act, they updated PEI reporting requirements to include evaluation of PEI programs with the annual update. So it happens at the same time. There is a PEI annual report that reports on consumers, their demographics, program accomplishments, and there are different PEI service areas, and we're not going to get into that today, but all of those different service areas will report slightly different implementation and outcome information. And there's also a PEI 3-year evaluation report, and that's actually what's going to happen this year, where we're actually going to report on the last 3 years, fiscal year 2021 to 2024. And that 3-year PEI report will be posted together with the annual update. They'll be within one report. So when we do submit this annual update, you'll be able to read the PEI 3-year report. And it's also important to note that Lake County Behavioral Health has been working with all programs to strengthen their data collection and strengthen PEI specific reporting. All right, so this is a slide that really just goes over in detail like community involvement and who we're really trying to bring into this conversation. And really that includes anyone that touches the mental health system. So this list on the slide is not an exhaustive list. So program planning, what we're doing today, we want to invite everyone that touches the system. And that includes adults and seniors with severe mental illness. We want folks that are family members of folks with severe mental illness, providers of mental health services, law enforcement agencies, educational agencies, social service agencies, veterans and representatives from veteran organizations, providers of alcohol and drug services, healthcare organizations. Really, this is such a wide range of community partners that we want to invite to this conversation. So if you don't see yourself on this list, this is not an exhaustive list, and we are so happy that you're here. So truly everyone in this room has a role to play when it comes to MHSA planning. So community members, so the folks that are here that are community members, we want you to be here to include and present your perspectives, your lived experience, and share reflections on strategies that would help meet community needs. The Behavioral Health Services Department, their responsibility is to develop the annual update and make sure that it's reflective of community needs. The Mental Health Advisory Board will assure community involvement and review and advise on the annual update and conduct the public hearing. So they're more of that advisory overseeing body. The Board of Supervisors will review and approve the MHSA annual update, so give it the stamp of approval. And then RDA Consulting, us, we are responsible for collecting and presenting findings on the current system, offer recommendations for the future, facilitate discussions, and compile all that information into an annual update. And lastly, here's a quick timeline of our program or planning activities. So everything in gray either has happened already or will happen in the future. So in December of 2024, last year, we kicked off this annual update process. And then we went into phase 2 from January to March, where we did the needs assessment. That included having the January community meeting. That included launching a community survey and also collecting program data. And now in green, we are in phase 3, program planning. We have synthesized all of your input and we're going to report it back to you all today and then continue getting feedback and hearing from you all how we can take those findings and make them actionable. And then next, from April to June, RDA and Lake County Behavioral Health will be working to develop the plan. We'll post it for public comment. We'll have a public hearing. And then once all that is over, once we have updated the plan based on input, Lake County Behavioral Health will then finalize the update and present it to the Board of Supervisors. All right. Right now, we are going to be running a poll on the Mental Health Services Act, training and education. We just want to get a sense of your understanding of MHSA. This is a requirement of the MHSA just to gauge community understanding. So if you can just take a moment to fill out the Zoom poll. If you are in person at a peer support center, we ask that you raise your hand in response to this question. Do you feel that you have a relatively good understanding of the Mental Health Services Act and Lake County's annual update and community planning process for fiscal year 25-26? So we ask that folks at the peer support centers raise your hands, and the coordinator on site will count how many folks raise their hands. And then if you could write that down somewhere, that would be great.
The reason we're going through this little exercise is the state wants some evidence that we actually train our community in what MHSA is.
Mm-hmm. Absolutely. So I'm seeing that we have about 16 folks have answered. So if you haven't filled it out yet, it should have popped up on your screen. Please participate if you are able. All right, we have 17 folks. Thank you, Circle of Native Minds. We have 6 folks agreeing. Thank you, thank you. So the Harbor, Lavos, Big Oak, if you're able to just make note of it. You can put it in the chat if you're available, but if not, you can let us know after the meeting. So I see folks agree, some folks disagree. Does anyone have any questions about MHSA or the community planning process? Right. If any questions come up, you can always email Scott Abbott. Okay. I think we can close the poll now. Thank you all for participating. If any questions come up, please feel free to send them to Scott, or you can throw them in the chat. I think I had someone throw something in the chat in the direct message, which I will respond to. Okay, here we go. So question is, what is the effective date of MHSA? Is it currently in place? Yes, MHSA is currently in place. It was voted on in 2004, but you may be thinking of the Behavioral Health Services Act, which we're going to go into right now, and that will become effective. Yes, BHSA. That will become, it is effective now. And so we are going to be transitioning to the Behavioral Health Services Act for the next 3-year plan. So great question, because we're about to talk about that right now. And I am going to pass it over to Jamie, but Allison, does that answer your question? Perfect. All right, Jamie, I'm going to pass it over to you to give a BHSA overview.
Yeah, and so we're just going to give kind of a quick overview if anyone's participated in these community planning meetings yet this year. This might be familiar information, but just kind of know that as guidance is coming out about the Behavioral Health Services Act, we're going to keep providing information. And as the year goes on, we'll give more detailed information as that comes to us. So this is just kind of a preview and a primer. Go to the next slide. Okay, so you might have also heard of Behavioral Health Services Act in the context of Proposition 1. And you may have remembered voting on this or hearing about voting on this last year. So BHSA is part of Proposition 1. And Proposition 1, so as Paulina mentioned, the Mental Health Services Act was implemented in 2004, and it hasn't been updated in the last 20 years. And there was some feeling that my dog is barking. I apologize if you do that, but there was some feeling that MHSA needed to be updated or modernized to kind of better meet the needs of folks experiencing mental illness. So that included expanding housing and also treatment options for people experiencing serious illness. So again, this was on the ballot, folks voted for it, and it was passed in March 2020. So there's two components to Proposition 1 or Prop 1. The first is this bond act, and this authorizes about $6.5 billion to build or develop behavioral housing and treatment. So this first part is really allocating money, expanding housing and treatment options. Most of this, $4.4 billion, is earmarked for inpatient and residential treatment options, whereas the remaining is earmarked for permanent supportive housing, including $1 billion that's reserved for veterans. The second half of one is BHSA, is the Behavioral Health Services Act. And as mentioned, this kind of amends or replaces the Mental Health Services Act and updates it. So the first thing that it does is that it renames MHSA BHSA. And the reason that this is kind of being the transition from mental health to behavioral health is because it's actually expanding services to include substance use treatment. So under the Mental Health Services Act, funding was really predominantly for mental health treatment, but now this can be expanded to include substance use treatment as well. The other big change is that this is going to revise the distribution of funding to prioritize housing as well as treatment. So when Paulina kind of went through the different categories of MHSA funding, those are actually going to change a bit in terms of the allocations as well as what funding can be used for. And we'll talk about that in a minute. Another change is that it's expanding the oversight and accountability measures. So like Scott said at the very beginning of this, now BHSA really is going to encompass the entire behavioral health department. So now rather than just this kind of annual plan, which really just focuses on programs that are being funded by MHSA, now this integrated plan is going to be looking at programs, behavioral health programs that are funded through the entire mental health department. It's going to include mental health as well as substance use services. There's some other kind of changes that are going on there, including like expanded stakeholder involvement. The plan might look a little bit different, but more kind of information will be coming out about what that plan will look like throughout the rest of this year. Okay, then we can go to the next slide. Okay, so there's a lot going on this slide, so we'll kind of walk you through it. But basically the top half of this slide is what the current allocation looks like under MHSA. And I want to say that the funding isn't changing, so it's still going to be a 1% tax on millionaires. So it'll be the same amount of funding that's coming through, but the way that it's going to be distributed is a little bit different. So right now, under MHSA, counties get 95% of any funding through MHSA. So of that 1% tax, counties get 95% of that. 5% goes to the state for administration and oversight. The first change is that there's going to be a little bit less going to the counties. So right below this kind of second blue pie chart, now we're seeing that 90% is going to be going to the counties rather than 95%. But the state is taking on a little bit more. So they're going to be taking 10%. 3 of that is going to go towards administration and oversight. But they're also going to have some dedicated funding towards workforce initiatives, as well as statewide prevention initiatives. So that's the first change. The second big change, so now we kind of have on the right side of this slide, we have this block at the top that's kind of the red, orange, and yellow. And Paulina already described this, but this is kind of the current funding allocation, where the majority of the funding, about 75% of MHSA that goes to the counties, is used for this community services and supports. Half of the CSS bucket goes towards full service partnership, and the other half goes towards other community service and support initiatives. So if you remember the slide, that includes things in Lake County, like the crisis access continuum, as well as some of the outreach and engagement, a little bit of funding going to the peer support centers. Then the next bucket is PEI. Again, this makes up about 20%, half of which goes to children and youth under the ages of 25. Other PEI can be used for other prevention initiatives. And the last mandated funding bucket is this innovation. Capital facilities and the workforce education and training isn't in here because counties don't have to use that money for those initiatives, but they can if they want.
And that particular funding comes out of CSS.
Yeah, thank you, Scott. Okay, so then this bottom kind of bar chart is how things are going to change. So for the most part, there's really no changes there's not any significant changes to full service partnership. So right now, about 39% of the total MHSA funding to a county goes to FSP. Under BHSA, it's going to drop down to 35%, but pretty similar. The big change is that now all of these other kind of funding buckets, so other community services and supports, PEI and innovation, they're not now all being funneled into this behavioral health services and supports funding category. So this is going to include, so half of this behavioral health services and supports bucket is going to go towards early intervention. Half of that needs to go to children and youth. Then the other remaining half of this behavioral health services and supports can go towards other services. So this would be things like the community services and supports, innovation, but basically kind of 60% of what was MHSA is now being funneled into 35%, which would be this behavioral health services and supports. The big change, so I mentioned in the previous slide that there's really a prioritization of housing. So now under BHSA, 30% of funding needs to go towards housing folks who are at risk of or are currently homeless and also experience behavioral health issues. Half of that housing bucket needs to go towards folks that are chronically homeless, and the other half of that housing is going towards folks towards other housing initiatives with a priority on folks in full service partnership. So it's a big change. We're adding in a new bucket. We're adding in housing that wasn't there before. And kind of some of these other services are being shrunk down a little bit to accommodate this housing bucket. So then on the next slide, so for small counties, The state recognizes that for small counties, this might be a struggle to allocate this much money towards housing. So small counties have the option to request an exemption from funneling money towards this housing bucket. So small counties, the state defines this as a population of fewer than 200,000 folks. So Lake is a small county that meet specific criteria. So some of this is still kind of being worked out. The current guidance is a little bit vague, but if counties meet specific criteria, like if their unhoused population is really small, or if it's really large, if they already have sufficient resources for housing, or they actually need way more resources for housing, there's different types of criteria that are kind of still being fleshed out by the state. But for small counties that meet this criteria, they can request to opt out of this 30% housing allocation. So what this means is if a small county opts in to this 30% housing allocation, then 30% of BHSA funds are going to be used to increase housing access. But what this means is that there will be less money for the MHSA PEI, CSS, and innovation components. I do want to note that some money can be moved from one funding bucket to another. So even if a county opts in to do this housing allocation, they could move 7% away from that to put that into this behavioral health services and supports bucket. So there's a little bit of flexibility there, but overall, there's going to be between 20 and 30% going towards housing and a little bit less kind of going towards treatment options. If a small county requests to opt out of this 30% housing allocation and they're approved by the state, so any request does need to be approved by the state to opt out. If they opt out, you don't have to divert 30% to housing, and the funding allocation will be similar to how it is under MHSA. We don't know exactly what that would look like yet, what the breakdown would look like. But we expect or anticipate that if you opt out of the housing allocation, basically all of that money would be going towards behavioral health services and supports and FSP, and it would look a little bit more similar to the way that MHSA is now. So Lake County needs to make a decision a little bit later this year about whether or not to go for this housing exemption. So the county is really starting to kind of just get a pulse check, see how the community is feeling about this, kind of get your input on whether or not you think that Lake County should go for the housing allocation, like the housing is a big issue and you really want to use that money towards kind of building these housing options, or if the county should opt out and kind of preserve funding for existing programs and services. So in a few minutes, we're going to do a poll about that. But I also just wanted to show that there is, if you want more information, the state did conduct some listening sessions, and this is a link to one of the PowerPoints that they used. And I see a hand raised. Elise, do you want to go ahead?
Yes, thank you so much, Jamie, for that overview. If you don't know me, I think I know everybody here, but just in case, I'm the director of Lake County Behavioral Health, and I want to let you know that our management team has been reviewing this since before Proposition 1 was passed. I want to level set that about half of the funding for our peer support centers comes from prevention, education, and early intervention. And so we would have to find out how to do that, how to continue to fund those centers. I want to also reiterate that we spend a significant amount of money on housing. Most of that is unfortunately in hotel rooms, and that is because there is an absence of permanent supportive or permanent housing in our community. So I want to clarify for this group that just even if we were to continue with this and have the change in budget and have to reallocate BHSA dollars to housing, it doesn't magically produce more housing, right? We don't magically get more housing because we're not house builders. So we already have unspent funds in full service partnership for housing because there's just not enough housing for people. So I just wanted to make sure everybody in this group was aware of that as we enter into thinking about feedback for us.
Thanks, Elise. And Scott, did you want to add anything else about kind of the local context of what this would mean for Lake County?
Yes. As has been discussed, this will be a topic of conversation, throughout this year coming up with community involvement, community and stakeholder input. As you can tell, what we've been discussing, this is, outside of the name change and an integrated plan, this is the biggest change that we're facing with BHSA. And so because it's such a big change, it's also very foundational of where we're going to be going in the future. So we have to, really make up our minds which direction do we want to go. And as Elise was emphasizing, and I echo, it's moving funding over to housing will definitely impact our other services and what we can provide. We've looked at other funding sources and options, but nothing is set in stone, other than what it has been previously. We also haven't been given exact criteria for what this exemption requires. What we've been able to find so far is it's based on what our pit count is, what services we have to offer, what things we've done. So a lot of it is going to be based on things that are a little bit out of our control. We can apply for it if we choose that, but it's no guarantee that we will even get it if we try and opt out of it. But we'll have to make that decision if we want to opt out of it or not. So it's a big deal. That's why we've been talking about it for over a year now. And as Jamie mentioned, it's we want to start getting your feedback in it. So we're going to be asking, based on a little bit what you know now, where are you leaning? Jamie, do you have that poll?
So we're going to do the poll in just after two more slides. So we just want to talk through no. We'll finish talking through the timeline and then we will bring this poll up.
Okay.
So again, I think this was to a question that came up earlier, is BHSA active yet? So it has been voted on, it has been passed. It doesn't actually start. So the planning process for it will start after this annual update is done. So it'll start, the next fiscal year starts July 1st, 2025. So that's when the county will start kind of planning for the first three-year integrated plan under BHSA. The county there's a year to kind of put that plan together. By the end of June 2026, the county would be approving this first integrated plan. And then starting July 1, that plan would become active. So just kind of wanted to give a little heads up about the timeline. And again, like Scott said, there's still things what are the specific criteria? What does all this mean? The state is still giving guidance on those things. So as we learn things, we will share those things with you. And kind of when the summer and fall comes around, we'll do a more dedicated effort in really talking about BHSA once we know more. And then on the next slide. So this is just some resources. If you really want to learn more, here's some links. Some are from the state, from DHCS, some are the actual legislation, if you're interested in looking at that, as well as some information that's on Lake County's website. All right, next slide. Before we move into the poll, does anybody have any questions? And I'll just add that we do have we have breakouts at the end that we can also address some questions. And I see Denise, you have your hand raised. Go ahead and unmute.
Yeah, yeah, I was just wondering in the housing, if the monies went to the housing, because I agree, we don't have any place to put them in the housing. Would that provide for building housing? Do you guys know?
No,
Okay,
it's not for
thank you.
infrastructure. It's just to pay rents or hotel costs and things like that.
Okay, okay,
And
thank you.
it's even if it was, you know, it's very expensive to build housing.
Yeah,
We just built, or the county just built with RCHDC, the new apartments over in Nice, Paulson's Place, and those apartments cost around $18 million to build.
wow, okay, that answers my question. Thank you so much.
All right. Well, then let's move into the poll. And so I want to say, so we're going to have another Zoom poll for folks that are participating on Zoom. For folks that are at the centers, there should be a paper printout of this poll. We really want to make sure that we're hearing everybody's voice, and also want to give people, allow you to be anonymous, just so you don't feel any pressure to like vote one way or the other. And again, this is just kind of a pulse check to understand what you all are thinking, where the community is kind of leaning. So you have that opportunity to fill that out, and then you can give that back to the leads at the centers, and they will scan them and send them to us, and we'll make sure we're including everybody's feedback. All right, we'll just give, I think we probably have everyone, but we'll just give maybe like 30 more seconds. And I also just wanted to note that these slides will be available on the website after this meeting. Patty will post them online. So these slides will be available if you want to have these resources.
And in Spanish too.
And Allison, thank you. I meant to say this. This is a good question. So understanding if the county loses money, if we do not use the money to build housing. Okay. So if you opt out of the 30% housing, you're not losing that money. So the amount of money that the county gets will still be the same. If you opt in, it's just that 30% of that kind of total funding bucket would have to go to housing. If you opt out and are approved to opt out by the state, which again, Scott said it's not a guarantee, but then you'd still get that same funding bucket. It would just be distributed differently to be able to use that for kind of all of the existing programs and treatment.
And I want to clarify for Lake County, that would likely impact our peer support centers. I don't know where we could source budget for that, and it could result in closures of centers.
Okay, I think we have everybody. And again, folks at the peer support centers, you should have this on paper, and make sure you just give that poll back to the folks at the center. Thank you all so much for your feedback on this. And again, this is just the one touch point. We're going to kind of keep getting the community feedback and input throughout this process. So we really appreciate you all kind of hanging in there and asking good questions.
I'm going to jump in really fast. I'm going to go back to the resource slide. I had someone message me wanting to see it one more time, but thank you, Jamie, also for talking about or discussing how this slide deck will be available. So you can click directly on the links if you go to the Lake County Behavioral Health website. I'll pass it back to you, Jamie. Sorry about that.
No, thank you. All right, so I think we are ready to move into the needs assessment findings. And again, I just want to say we will have breakout discussions at the end, partly to discuss these findings, but if you also have questions about BHSA, that's another kind of opportunity that we can talk about that a little bit as well. Okay, so the community needs assessment. So we've, as part of the community planning process that Paulina talked about in the beginning of this, so one of the ways we're really getting feedback is through these different activities to engage the community. One of these things was through a community survey. Some of you may have taken it, but this was open for about a month, and we had 49 people complete the survey. We also had the first community meeting at the end of January, and we had 65 people participate in that. So the total participants that we've had so far in the community planning process is 114. This might be duplicated because I'm sure there's some people that took the survey who were also at the meeting, but just really appreciate all of you kind of coming and joining and participating and providing feedback and helping us understand the community's needs. The chart on the right is kind of the breakdown of the types of different community participants. So the largest group was behavioral health services provider, making up about a third. 21% were behavioral health services participants or a family member or loved one of somebody participating in behavioral health services. We had 26% representing other community partners. So healthcare providers, social services, educators, law enforcement, veteran services, consumer advocates. Like we had a really wide kind of array of folks. So again, we really appreciate everybody's involvement. We did have, and we get this information from the demographic survey. So this is just another plug to please fill out the demographic survey because it helps us understand who is participating. So you can see that we had the community affiliation was unknown for 37% of folks. And we'd really love to know who you are. And the demographic survey allows us to do that. So if you can, we would appreciate you filling that out. But this is just kind of a breakdown of who has participated. In the next few slides, we're going to actually show the findings from the community needs assessment. And this is based on information from the community survey. For folks who didn't take it or might not remember, the survey was 13 Likert scale questions with statements. And we asked folks to rate whether these statements were very true, mostly true, a little bit true, not at all true, or they didn't know. The survey also included some open-ended questions. And then we also had breakout discussions in our first community meeting. So the findings that we're going to show in the next few slides are the findings from the Likert scale questions of the community survey, as well as kind of key themes that were pulled out from these open-ended questions, as well as the discussion that we had in the first community meeting. All right. Okay, so another dense slide, but this is, so on the left, these were all of the statements that were in the survey that we asked folks to rate whether they were very or mostly true, a little bit or not at all true, or they didn't know. So the green represents the proportion of folks who said these statements were very or mostly true. The gray were people who responded they didn't know or wasn't applicable to them. And then this yellow gold are the ones that were the proportion of folks who said that this was a little bit or not at all true. And the survey was broken down into kind of 3 different domains: needs of the population, access to services, and then service experience. So in this first kind of third, this first grouping, this is the population needs. And we saw kind of a mixed response. So in this first kind of bar, we see that 71% of folks felt like peer support services meet the service and resource needs of the populations that they serve. So most people are feeling like the peer support services are meeting the needs. This last bar is showing that there might be some need for improvement in prevention and intervention services, where only 39% of folks felt like prevention and intervention services help people before they develop serious mental illness or substance use disorders. In the middle, we see a little bit more of a mixed response, where slightly over half of folks felt like Lake County services are meeting the needs of people experiencing a behavioral health crisis, and that Lake County's behavioral health services meet the community needs overall. In terms of service access, we're also seeing, so this first line is showing that most people, 83%, said that they know who to call or where to go if someone needs behavioral health support. But then on the flip side, this last bar is saying that only 44% of people feel like it's easy to get a behavioral health appointment when they or somebody needs one. So we're seeing that people know where to go and who to call, but they're still finding it difficult to get an appointment. We also saw that 71% of folks felt like behavioral health services are available at convenient locations, but only 56% of folks felt like services are available at convenient times. And then this last kind of group is the service experience. And overall, we're seeing that for the most part, people really reported positive service experiences. So the majority of folks, between 2/3 and 3/4, felt like Lake County's behavioral health services are supporting clients' wellness and recovery. The services are respectful of clients' culture, that services are welcoming, and that providers work together to coordinate services. Fewer people said that clients and family members are involved in decisions about their care, only 49%, but we also saw a large proportion of people, 28%, said that they didn't know or this wasn't applicable to them. So that's just kind of something to bear in mind. But this is just kind of the quantitative data. I'm going to pass it over to Paulina to dig in a little bit more into the qualitative data and some of the themes that were emerging that might also help better explain some of these quantitative findings.
Thank you so much, Jamie. Yes, so we're going to be diving into the qualitative data. So this is more of the narrative. This is what people are saying. And qualitative data, like Jamie was saying, is a great way to further expand on what we're seeing in the quantitative data or in the numbers. The qualitative data came from the survey, so those open-ended questions, as well as the small group discussions that we had at our last meeting. So we're going to kick it off with Lake County Behavioral Health System strengths. First and foremost, staff are welcoming, caring, and passionate, and they work together to meet the needs of their clients. And you can read in the top quote, the top call-out box, it says, the staff at Behavioral Health are truly outstanding. They work their darnest to meet and exceed the needs of their clients. Next, Lake County Behavioral Health leadership is seen as approachable, engaged, and innovative. Particularly as a small county, folks feel that Lake County stays on top of new initiatives and actively implements new and innovative projects and approaches. And they feel that Lake County has adapted to respond to community needs, and partners have noticed very positive changes over the past few years. Next, Lake County Behavioral Health Services are seen as available, easy to access, and responsive. So you can read that bottom quote where it says, they are accessible, 24/7, and peer-led, responsive, and holistic. So now going on to the bottom row of icons, Lake County, folks feel that Lake County employs very creative outreach methods and approaches to engage community members. So using social media, implementing the outreach van, and hosting community events. Folks really feel that Lake County is dedicated to meeting clients where they're at. Folks also called out crisis services and felt that they are responsive, helpful, effective, flexible, and economical. And then lastly, Lake County uses a peer-led model, which is very effective at serving the community. Particularly, respondents called out the peer support centers and saying that they're essential to the community and essential to meeting the community's needs. So peer support centers help folks find services and provide a space for clients to talk to a peer. And then on the flip side, we have some gaps and persistent needs. These are just what emerged from the data. And first, I'm going to start with suicide prevention. Folks felt that there's a gap in the current behavioral health system, and there is a need for more funding and guidance in the area of suicide prevention. Next, substance use. Folks, the respondents noted that there are multiple unmet needs around substance use. So particularly a need for detox centers, more sober living environments, and temporary housing, specifically for folks who are at the intersection of homelessness and substance use. Follow-up and continued support. So folks noted that there's a lack of follow-up for those clients that transition out of services, and that they would benefit from continued support to prevent future mental health crises or challenges. So you can read the top quote. It says, often people receive services or make it through a program, but they're not given the tools to succeed afterwards, and often end up back in similar situations or fall through the cracks. Next, I'm going to combine the next two, services for mild to moderate needs and prevention. Folks just noted, and this is similar to what Jamie was talking about in the quant data, talking about the need for more prevention services, and folks also noting that there's a need for more providers for patients needing mild to moderate services. And you can read the bottom quote. So I feel that Lake County struggles, as most agencies do, to prevent or address serious mental illness or substance use before they develop. So this is also, like they said, other agencies, it is a challenge in general. All right. Next, we're going to go through some of the populations that were called out as populations that are being underserved or are in most in need. So we'll start with youth. So young adults and teens. So young children, folks felt they don't have enough services available, including more specialized services. And then teens and transitional age youth have unique mental health needs related to bullying at school, social media, and folks feel that there are concerns around suicidal ideation and housing for this group as well. Next, we have older adults. Older adults often do not seek out help because they have difficulty navigating technology or transportation. So it makes it more difficult for them to access services. Also, there are older adults who are more isolated, and they often don't engage in the community, which makes it also hard to access services. And particularly, respondents called out that there is a lack of services for older adults who are unhoused, which is a growing population. And with that, those who are unhoused or houseless was named as a community that is in need. So along with needing more housing in general, the unhoused population is also in need of more behavioral health services and basic need services at the moment that they need help. So if you look in at the right comment box, it says, while we've gone leaps and bounds with unhoused folks, being able to access services in that moment when people are ready to get help, that is a huge challenge and gap in our system. When someone's ready for help and they don't qualify and they get another number, they give up. And then lastly, we have historically marginalized groups. So historically marginalized groups are viewed as some of the populations most in need and are underserved, and particularly Black, Indigenous, and people of color or BIPOC communities, as well as LGBTQ+ communities as well. Community partners mention that these groups do not receive enough support, and particularly there are groups that are impacted by the new administration as well, where there are concerns. And then to round us out, we're going to talk about opportunities to address these needs and challenges. I do want to note that you're going to see that some of these areas for improvement were also referred to as strengths of the system. And so this indicates that there are some conflicting perspectives among community partners on some of the topics below. So firstly, there's a call to increase the number of staff and providers to address the needs of the community. Particularly, there is a lack of mental health providers, which limits capacity and results in wait lists. And even more specifically, there is a need for more peer and outreach staff. So you can see in the top quote, While the peer support centers provide a valuable service, there isn't enough staff to provide effective services consistently. Next, we have improved service accessibility. So some folks thought this accessibility was a strength, but others called out maybe a need to improve transportation options, establish more locations, kind of like what Jamie was talking about too during the quant data. Also offering later appointments for those who work and improving responsiveness of services. Next, we have a call to share more program information across the community, particularly to raise awareness of the available services and resources, as well as eligibility criteria. So people called out that people often seek out services and are turned away because of eligibility. And that may be just not being aware of eligibility criteria, but this could also be conflated with maybe perceptions around insurance too, that we heard a lot in the data, where there may be some confusion there. Next, we have improved cultural responsiveness. So that includes diversifying leadership, building cultural responsiveness of staff, their educational efforts, elevating community voice, having community members in decision-making positions, and increasing outreach and engagement with tribal communities. So you can see in the bottommost quote, talks about cultural competency trainings for staff. Second to last, improve staff and cross-agency program collaboration. Some community partners feel that there is a lack of communication between programs and staff, and that there's a need for more collaboration across staff that work in different service areas. So for example, collaboration across clinical staff, peer support centers, and crisis. So kind of at the intersection of these different areas. And lastly, respondents talked about improving the service environment and the experience of services. So to support welcoming services that are equitably provided and inclusive of family support. All right. I think that's my last slide. So I'm actually going to pass it over to Scott to give us a strategies update for this fiscal year. Take it away, Scott.
Okay, so what this is kind of a listing of some of the things we've been working on over this past year, some things that we've been, working on developing and accomplishing. Just kind of go through them real quickly. We're enhancing our presence in social media. We have a new staff person, fairly new staff person, Megan, who is her whole job is just making the connections to the community, letting folks know what we do, how we can help, getting feedback from the community. And one of her functions is working with social media. And a lot of you may be here because of her efforts of putting information about this meeting on social media. Our prevention folks have participated in quite a bit of activities that we do. When I mean activities, I mean public activities out in the community, at public events. One of the things that we did last summer, and we plan to do this summer, and we've done actually for a few years now, is participate in Lakeport concerts in the park. We make a whole lot of connections with folks for that. We also, for the first time, had a booth in our in the Clear Lake Christmas parade, and it actually wasn't a booth; it was a float. Did I say booth? Float. Sorry.
You were Santa Claus on the float, Scott. You ought to remember.
Yeah. Thanks for rubbing that. Reminding me. We've also have a really fully implemented mobile crisis services. This has been, I can't really understate the significance of this. It's really transformed our abilities, not just to address crisis out in the community, but it's been a great bridge to further other services as well, because we're making more contacts with people than we did, people coming into the ER or just for services. We're actually, going out for people that are in desperate need of services and finding them and getting them into services. So it's just a super significant part. We work really closely with law enforcement. Like I said, it's a very, very big transformation that we've done. We also, work with our suicide prevention awareness. That's another initiative that we're really working around. Kendra and April are doing a lot of work in this area. Over in the services coordination, we do a lot of this as well. Training, currently we're training staff to use the Pathways hub, which helps make connections with other service entities in our community. Just kind of a reminder, behavioral health, Lake County Behavioral Health is unique in that we are the administrative entity for our housing continuum of care, which the hub is connected to. And so it really puts us involved with housing in our community. I don't know of any other behavioral healths who do that across the state of California. And so it really shows our commitment to working with the homeless and housing. Let's see, we're also partnering with community-based entities to develop emergency, transitional, and permanent housing, as I mentioned before. This is again through the COC quite a bit. We're developing like an eviction prevention services. Hopefully that will be online within a few months. And we're working out the details with that. Peer support centers are access points for housing coordinated entry, which is again us working with the COC and our peer support centers do work with a lot of folks that are facing homelessness, and so they are access points to help people get into services for housing. There's not a lot, as we mentioned before, it's not a lot of housing resources, but at least getting into that system can help get people going in a positive direction. We provide services for specific populations, continuing to develop the Native American peer counseling program with the Pathfinders, which are the elders of the Circle of Native Minds. That's really exciting to me. I really enjoy going to those planning meetings. We've hired outreach and prevention specialists for older adult population services. Also very significant, as recognized on a previous slide, that's a population that we really need to address. We have a super outreach specialist. I think she's actually here, Denise, if you're here. Just a wonderful person who is really developing not only just outreach, but actually programs that can help older adults, but particularly with isolation, as was mentioned earlier. We also are opening, we just opening Pallison's Place for housing. As that was also mentioned, which have 20 units for our clients. People are moving in as we speak, literally as we speak. People are moving into those units, so that's really exciting. That's 20 permanent housing units and probably some of the best housing in the entire community. I mean, they're just gorgeous units, and they're affordable for our folks. It's just partnering with RCHDC and getting those developed is just literally a godsend. It's just a wonderful opportunity for our community. Workforce education and training. You just mentioned that a little bit. We have a coordinator working with that. Jerry, in one of her many tasks that she does, she works with this, the ensure that our staff are getting training. We work very much with the regional partnership, which helps fund things like for education, including loan repayment and stipends and scholarships for people that are going through housing. One of the ideas that we have, and this isn't kind of really mentioned here, but I was reminded by a previous slide, is we really have a strong belief in peer services and peer leadership and peer everything. It's really ingrained in the idea of what WET does. It helps peers, it helps people grow and get education and grow within our behavioral health organization. It's something that I take a lot of pride in that we have, and that we really work, to develop our own peers to further themselves in the community. The reason I really believe that is, take a little side thing. I strongly believe that is because people that, the peers that we have, they have real roots in our community. They know what our community is like, and as a result, they're going to stick around. And so when we develop, grow within ourselves, we are strengthening the community, and not only through people improving, getting education, but also those people in turn then help others in the community. And so it's just I think it's a wonderful thing that we're able to do. Unfortunately, with BHSA, they're taking over some of the WET trainings as a statewide level. That was some of the 5% that we're losing. But we still are going to be very invested in furthering development for our staff and for our peers. Okay, Jamie, I'll turn it back over to you. Or was it Paulina? I forgot who was.
No, that's perfect. Thank you so
Sorry.
much, Scott.
Thank you.
Thank you. Thank you. Either one of us is fine. This was a great update. Thank you so much for going through the different areas and how you and your team are responding to the community needs. Appreciate it. All right. So now we're going to head into a short break. It's going to be just a quick 5-minute break, but feel free to go grab a snack, grab water, stretch your legs, and we'll probably come back and reconvene, let's say like 11:30, maybe. We're running out of time, so maybe more like 11:28. So I know that's very specific, but you'll probably hear my voice when we come back together. But enjoy your break, and we'll see each other in just 5 minutes. Thank you. All right, we're going to come back together in the next minute or so. Just wanted to give everyone a heads up. I need to share the right screen. Thank you for your patience. All right, how does that look? Is that the correct screen? All right, thank you, Denise. Perfect. Okay, get my screens together. All right, as folks are joining us again, sorry that was such a quick break. We are running a couple moments behind, so we need to make up some time. So thank you for bearing with us. So now we're going to be moving into our breakout discussion. Like we had alluded to this earlier, we're going to go back into small groups and we're going to discuss the findings and have a good conversation around forward thinking, what could be done to continue meeting the community's needs. All right, so these are the questions we're going to be going over in our groups today. Firstly, what about the needs assessment themes and findings stood out to you? Are there any community needs that you think should be highlighted but are not? Is there any additional context or detail you would like to add to any of these findings that was shared? And what community needs or noted opportunities for improvement do you feel are the most urgent for fiscal year 25-26? And as needed, if there's time, we also want to build in discussion around BHSA if anyone has any questions. So what we're going to do is I'm going to stop sharing my screen and Patty is going to put us into breakout rooms. If you are at a peer support center, you have the opportunity to have the focus group on your own, or you can contribute virtually with us at the same time. So we'll give you that option. Let me stop sharing my screen. All right. Patty, I think we're ready for the breakout rooms whenever you are. Let me think if there's any other guidance. I think that's it. Does anyone have any questions before we go into the rooms? All right. Awesome. Okay, Patty, feel free to open them, or I think I can also do that as well.
I have the questions. No. I just found the.
I did, okay.
Yeah.
Perfect. All right, the rooms are open. You should see a pop-up on your screen inviting you to join a room. Click join and we'll see you shortly. And if you have any questions, you can stay in this room and Patty can assist. Thank you all.
Sorry to cut everyone off. I was trying to make sure we had
This is
time
Rachel.
at the end.
No, thank you, Patty. That was perfect. I know, Jermaine, I caught what you said at the end, so I think we're good. Yeah, so now I'm not going to share my screen just yet, but right now we're going to just report back and hear what each of the groups talked about. And so Jamie or I will go and talk about what our group discussions brought up. And then we'll also open it up to the peer support centers that did their own focus group or their own small group discussion, and they can share what they talked about as well. Jamie, do you want to go first, or would you like me to go first?
Yeah, I can go. So in thinking about like the themes and findings that stood out, some folks said that, there has been a lot of effort on the crisis services and kind of improving and expanding those services, especially with the mobile crisis team. So really glad to see that that was kind of reflected in the findings. Also happy to see that that there's appreciation for the leadership and staff and kind of being friendly and outgoing, and that's also been something that the county really is working on and prides itself on. There were some comments about for outreach and in prevention that some of that work, there's a lot of work happening in the schools, and that might not be reflected or really understood kind of by the wider community, and that there's probably needs to be kind of more of an effort to get out that messaging of what those services look like and how much really is being done in the schools. And thinking about like how to just keep raising awareness and kind of keep talking about those things and make sure that people understand like what is available and what's happening and all of the breadth of prevention and outreach work that's being done, and that it really can look different kind of across different agencies and departments. In terms of kind of like the priorities or the things that are most urgent, so was informed that there is some work with the Lakeport Unified School District to come together with different departments, with different representatives, and kind of really think about what can be done within the schools to increase access to services and find out what those needs are for their students and families. So that's something that's kind of already in the works, but also a priority that we heard with addressing the needs of children and youth. And also improving accessibility. So again, kind of highlighting that like mobile crisis has been a benefit, but not everything is a crisis, and that people might not always meet those needs, but really trying to find more ways to meet people where they are at the times that they have those needs. And just in some of the additional context, also kind of just noting that that one of the pain points can be when somebody doesn't qualify for Lake County services and is being referred to a different program, that can sometimes be a delay. So also looking into that. Does anyone from my group have anything else you want to add? All right. I'll kick it over to you, Paulina.
Awesome. Thank you for that overview. Looking back at my notes, and anyone in my group, feel free to also come off mute or add in the chat if there's anything that I miss. But when we talked about what themes and findings stood out, folks talked a lot about the older adult population. So that was one of the populations that was reported most in need and being underserved. So just talking about the isolation that is happening within that community, and that there are some older adults who are isolated, and there's others that are able to do activities but choose to also isolate. So these are the folks that need to be outreached to. And there's a lot of work around this in the COC, and they've been looking into that. So addressing who those vulnerable populations are, and that includes those who are experiencing homelessness and are older adults as well. And that these individuals need wraparound services to maintain stable housing once they are housed. Also, another population that was discussed that was presented about was youth. So that's another population that folks feel should be addressed or is seen as most urgent for the next fiscal year, and particularly youth, and then suicide prevention as well. And then we had some great question and discussion around BHSA, which was really great in clarifying the small county exemption and trying to discuss, like, is there a win-win? How can we find a solution that works best for the community? And so we had some conversation around that. Anyone else in my group want to add anything in particular that I may have missed?
Paulina, this is Carrie over at the Circle. And we also talked about our older adult population and how there's a huge, the population is growing of our older adults. And there's a lot of fear based on, new policies that are coming down from, above. And we definitely agree that more training on their needs is important, and not just like physical needs, but how to determine if somebody's having a medical crisis, if they're having behavioral health crisis, or if it's like dementia or some other kind of medical problem. We have a huge population of older adults that are living in their cars. And also we discussed the inequality and tech literacy, like not being able to access services over the phone or the computer or, and so having people able to help them complete their forms, or like applications for apartments or some of that. We talked about the need for more staffing at the centers, as well as, how our outreach services could be increased and developed more. So that was kind of what we talked about.
Thank you so much, Carrie. That was, yeah, very similar to what my group talked about and talking about the older adults. And I'm also seeing overlap with Jamie's group. So
yeah,
thank you.
Yeah, thank you guys.
Yeah. Are there other peer support centers that would like to share what they talked about? Not required, but oh, I see the harbor.
Yeah, so in our discussion, the biggest thing that stood out to us from the findings was how big peer support was on there, how people love utilizing peer support services, that peer-led organizations and peer-led movements are really important to the community, as well as, like, we talked about BHSA a little bit, and with those findings of how important that peer support is, hearing that some money can be allocated elsewhere outside of peer support services, we were all like, so we were just mostly talking about the importance of peer support and modeling recovery within our community, mainly for our youth and our older peers. We were discussing like no wrong door policy and collaborating with organizations to be able to best refer clients to programs that are applicable to them, as well as for a minute there, we were talking about our LGBTQ plus youth and how, with like the current political climate, that's a community that we feel needs extra support right now, as well as our older adults who are unhoused with like current weather conditions. We talked about how other peer support centers might be lacking staff, as well as like outreach, and just really, maybe we're a little biased because we're a peer support center ourselves, just strengthening peer support services and staffing for those programs.
Yeah. Thank you so much.
Yeah, of course.
Thank you. Thank you. And we've been taking notes too. And for the other peer support centers, if you did your own focus group or small group discussion and you took notes, you can share those back with Patty after this meeting. I see we only have 3 more minutes left, so I am going to share my screen again and we're going to talk through next steps. So let me get everything back to how it was. All right, share the screen. Okay. Next steps. So our next steps RDA and Lake County Behavioral Health will be writing and developing the annual update, the end of this month and then mostly in April. Then we're going to post the annual update for public comment from April and May, and then we'll have a public hearing at the end of May or the beginning of June. All right, and I think with that, we're going to be concluding this meeting, but if you have a few moments, if you could fill out the meeting feedback form, that would be so wonderful, as well as our demographic form as well. Just like Jamie and Scott have mentioned, it's really important for us to know who's in the room so we can report that to the MHSA Oversight Committee. So yeah, if you have a moment, that'd be great. If you're in person at a peer support center, please feel free to fill that out on a paper form that should be available to you. And I think that.
And our next meeting will be our public hearing.
Yes.
Which will, that's where we'll be posting the plan for 30 days to get feedback from you all, from the community, from the Mental Health Advisory Board. And then following that 30 days, we will have a public hearing that the advisory board will be actually hosting for us. To get any more additional feedback that we'll be able to incorporate before we'll be presenting the plan to the Board of Supervisors. And then it'll be official.
Paulina, could you go back a slide to the QR code? Someone asked me in chat.
Absolutely.
Thank you.
Yeah, no, thank you. And also thank you, Scott, for elaborating too on what that period of time will look like. And we invite everyone to participate in the public comment period as well as attend our public hearing, which will be happening at the end of May or the beginning of June. So we're really excited for that. And I know Patty and Lake County Behavioral Health will be sending out emails and communications and calendar invitations very shortly. And please RSVP if you're able to make it to our hearing.
Yeah, so you'll all be receiving notice of the 30-day posting with links to be able to read it. It'll be posted in our peer support centers to be able to read. I think we put in the libraries too, don't we, Patty?
All the public libraries and both of our clinics in Lucerne and Clear Lake will have them as well. And as soon as we have the dates nailed down, that's when I'll start sending out the calendar information for those events. Oh, and this meeting recording will be made available later today.
Thanks, Patty.
Thank you, Patty. Awesome. All right. Well, it is 12:01. I've kept you all 1 minute after. So yeah, thank you all so much for being here. Thank you for your patience, for engaging, for participating. Your voice is extremely important, and we appreciate that you're here to be with us and share your perspectives. And we're excited to develop this annual update. Thank you.
Thank you for your time.